Can supporting information from work overseas be included in the appraisal portfolio? This video explains if supporting information from work overseas can be included in the appraisal portfolio of doctors. From RCGP Revalidation Mythbusters 2016.pdf. The GMC Protocol for Responsible Offices, ROS, making revalidation recommendations states at 2.3.2, doctors may practice in settings where they do not require a UK license. For instance, they may work abroad, or they may undertake specific functions in the UK that do not legally require a license to practice. Where this is the case, it is at your discretion whether you consider supporting information from these practice settings in making your judgment. You should consider whether such information is material in your evaluation of their fitness to practice, taking account of whether it is demonstrably relevant to the doctor's licensed UK practice and the proportion of the doctor's supporting information that it represents. The GMC requirement is that your appraisal and revalidation portfolio should include supporting information about every part of your scope of work that requires a UK license. As the above makes clear, your RO has the discretion to consider supporting information from other settings in making their revalidation recommendation. Even in UK practice, you may attend CPD events overseas. It is appropriate to check that the content of such an event is applicable to your scope of work rather than assuming that it will be acceptable. The RCGP recommends that you discuss any proposal to include any such additional supporting information with your RO in advance of your revalidation recommendation date. It is likely that clinical work overseas will have a significant overlap with clinical work in the UK, and it may well be appropriate to include supporting information relating to work overseas where it has wider application in demonstrating the quality of your reflective practice. If you are unsure, use your appraisal as an opportunity to reflect on what is appropriate and proportionate with your appraiser, and then agree it with your RO in good time before your revalidation recommendation is due. From RCGP Revalidation Mythbusters 2016.pdf. For further information and support, please visit Medical Appraisals at http://medicalappraisals.org.uk.